Tēnā tātou katoa, ngā mihi atu ki a koutou I tēnei ata. Nā te mea, we'll start our webinar with a karakia, ngā mihi atu. Haere mai haere, ki te ao whānui I te rangi Mārie. Kia maia, kia kaha, kia u ki te mea tika. Kaue e utua te kino ki te kino, engari manakitia. Kia tau mai anō ki a tātou katoa, ngā manakitanga, a te atua kaharawa, a te matua, a te tama, a te wairua tapu, āmene. Go forth into the world in peace. Be brave, be strong, and stick to what is true and right. Do not be distracted by the bad, but rather be caring. Let us all be comforted by the love and care of our Almighty God, His Son, and the Holy Spirit. Āmene. Anō te mihi ki a koutou katoa e te whānau kua tai mai I tēnei ata. E mihi ana ki ngā mate tuatini o tēnā marae, haere ngā mate, haere atu rā. Nā, ka hori ki a koutou katoa, ngā whānau kua tai mai I tēnei webinar. Kore au e moiho te kupu Māori mō webinar, nā te mea ngā mihi atu ki a koutou. Ki a koutou ngā rangatira, Dr. Colin Tukitonga, kia koe Amohia Bolton, me te rangatira no Kevin Haig, ngā mihi atu ki a koutou katoa. Nō reira, haere tonu tēnei kaupapa. Ko tōku ingoa, ko Lisa McNabb, ko ahau te himana o tēnei wāhanga, nō te pātū me te rāroa, mai te hiku o te eka, noho ana hau ki reira, mahi ana hau ki te taha o ngā iwi toko toru o te hiku o te eka. Nō reira, tēnā tātou. So, welcome everyone. You're in the right house for the Racial Justice and Emergency Responses webinar. I'd like to welcome you all. Nau mai, hara mai. Great to have you and seeing the numbers increase as we carry on this morning. There's going to be, there's a community code that is up here on the screen now. That's going to be pasted and cut and pasted into the chat a couple of 3 times during the session, so you can see how, what the code is for our kaupapa going forward. Also going up on the screen is our accessibility info. This will be also cut and pasted into the chat and a couple of times through the session again, so you can see how, what is happening and how you can do all of what it's saying there on the accessibility info. Okay, so we do have a moderator on hand who will be doing the questions in the background. So question and answer, do put them in the chat. And they will be moderated and come through to myself to ask those questions of our panelists towards the end of the session. Our speakers this morning, as you know, they are 3 rangatira in their own right, in their own mahi. We know this morning's list, Amohia Bolton. She is going to start our session. Amohia comes from a research background, and I know you guys have seen their profiles beforehand. And Amohia is going to take us through the mobilisation of community. Following Amohia, we're going to hear from Dr. Colin Tukitonga, who is and has worn many hats and still does. But I know from Colin that the most rewarding of his participation in the COVID response has been the drive-ins that have been organised in South Auckland. We have also Kevin Haig. Now, I just want to be clear that Kevin's presentation is going to be on the civil defence, but he's not speaking on behalf of civil defence emergency management. He is speaking as one of many controllers that have participated in the civil defence response, emergency responses. So whānau, that's who we have this morning as our speakers. Ngā mihi atu kia toko toru, ngā rangatira amuhia Colin me Kevin, mea koutou whānau kua taimai I te whakarongo e ngā tangata. Nō reira, anei te toko kia koe amuhia I te tīmata a tātou tō mahi rangatira. Nō reira, tēnā tātou.
Kia ora, Lisa. Tēnā koutou katoa, kua taimai nei I tēnei ata mō tā tātou hui, mai te hui topa, ko Amuhia Bolton tōku ingoa, hu uria hau no Tauranga Moana no Taranaki hoki. Engari, ko te kai whakahaere matua o Whakaua Research Services, tētihi rōpū rangahau no Ngāti Hauiti I te Rangitike. So good morning, everyone. I'm Amuhia. In my pepeha, briefly, I'm from Tauranga on my mum's side and Taranaki on my papa's side, but I work for Ngāti Hauiti, who are an iwi in the Rangitike region. I head out Whakaua Research, which we think is still the only iwi-owned health research centre in Aotearoa. For this presentation, I'm hoping what I'll do is provide a bit of a background to the work that we did during the COVID lockdown period, and a bit of a background, hopefully for this conversation, to get our conversation started. So very high level kōrero that I'm going to present in my 10 minutes. Specifically, I want to speak about some concepts such as rangatiratanga. These will probably be very familiar to you all, but I just want to put a particular local spin on them. So this idea of rangatiratanga and then the characteristics that we saw from our leaders during the COVID lockdown of whanaungatanga, kotahitanga, manakitanga, and then what happened in our comms space. The information that I'm going to provide comes from 3 sources. So because we are a research unit, we realised very quickly during the COVID, when the COVID variant was announced coming into New Zealand, and then during the subsequent lockdown and then the subsequent variants that came out, that we needed to capture the stories of what was happening both locally and nationally. And so for that, I'm very grateful to Te Rauora and Kahu McClintock in particular, as we gathered stories from across the country, from iwi providers, health providers. So that's one piece of information. The other piece of information that I'm drawing upon heavily today is some research that we did with our own local collective, our collective called Te Rangatupua, which is 12 tribes within the Te Taihauru area, South Taranaki, Wanganui, and across into Mokai Pātea and down through into Bulls. And then work undertaken as part of an ongoing project across 5 years that was looking at what was happening in primary healthcare, and we did a major pivot during that time to look at what was happening with COVID. One of the first things we saw when COVID was first announced was our leadership mobilising very quickly and exhibiting their rangatiratanga in this space. They moved, in our view, much quicker than the government did to mobilise the resources they had at their disposal, whether they be human or other resources. And they, especially if I speak for our local area, were able to respond within 3 days of the government notifying the country that COVID had arrived. And this was mirrored throughout the country. We know that the iwi response was incredibly rapid and incredibly quick, because what had been happening in their minds, of course, was that our experiences around the influenza pandemic were still only a few generations away in our minds. So we knew from our memories, our very recent memories, the potential impact that this could have, the devastating impact on our whānau. So immediately, leadership from our iwi was incredibly important. If we think below that level of leadership, what was happening? Sorry, just having trouble with my slides now. There we go. Probably one of the first things that we noticed was, and that was really driving our leadership, was the notion of keeping our whakapapa, protecting and preserving our whakapapa, and protecting and preserving our whānau links. So leaders were mobilising and using whanaungatanga and whakapapa to get resources and people into the places that they needed it most. Whanaungatanga also for us as Māori working on the front lines meant not only looking after our own whānau and our collectives more widely, but also looking after ourselves, our own people, our own kaimahi who were on the ground doing the work. It was incredibly important that we kept ourselves safe as well as we were trying to keep our whānau safe. And so one of the key things we saw was our whānau as kaimahi being able to work with other whānau who were their own, and then extending those links and the ability to reach people who were isolated. For us, it meant being up in the top reaches of our rivers. We could easily, as Māori, connect with those people, understand their needs. The next point I want to share is the notion of, which is closely connected, but this notion of kotahitanga. For us, kotahitanga meant, sorry, I just can't see my titles. For us, kotahitanga again was about that collective. It was again about looking after ourselves. So while the leaders had a collective vision and a collective view, they were able to speak that view down to our kaimahi on the ground and allow our kaimahi to work in ways that they needed to work and get the resources that they needed to get to our people. Our collective vision in no way meant that individual iwi could not use their own or could not employ their own mana motuhake in this space. And we saw this most evident, for example, in Aotearoa, where we had iwi who were determined to put up roadblocks. So while there was a collective vision that we would protect our whānau at all costs, a few iwi took that to mean we have to block our communities from people who were trying to travel during lockdowns into our communities because they were the most vulnerable. And this too was mirrored throughout the country. We saw this happening also in Northland. There were efforts by iwi there to lock down roads to keep people out of communities and in coastal areas as well. So while at one level we had the collective, the leadership strategically working across 12 iwi in our local region, we also ensured that we had local rangatiratanga showing and being demonstrated at all times. We kept our collective strong. We pivoted and used, at that time, we used a whole lot of different and new technologies. I think we became much more familiar with Zoom. We had ways of, as a collective, keeping ourselves safe over these new technologies, and regular karakia in Aotearoa, and I'm sure in others, became a regular feature of us being able to stay connected, prevent that isolation and loneliness, and receive uplifting of our wairua during this time. And again, another thing that is closely connected to the concept of kotahitanga and whanaungatanga is how we looked after ourselves and each other as the lockdown progressed. So one of the key ways in which this is demonstrated in the Te Rangatupua area was we had a government who determined that anyone over 70 was in need of protection and should stay home and keep isolated. For our particular rohe, our iwi leaders determined that it would be anyone over the age of 60, because we knew from our own inequalities and from our own data the impact that this would have on us. And our iwi leaders were quick to ensure that from a collective point of view, from a manaakitanga point of view, from looking after all of us, that sometimes decisions needed to be made that were different to what the government was saying. In terms of communications, again, there was a central hub for communications, but what we saw in the Te Rangatupua space especially, which was again mirrored throughout the country, was our communications experts taking the wealth of data or information that was coming from the Crown and repackaging it and translating it and making it more accessible and easy for our whānau. There was a huge amount of information, not all of it good, that was coming into our whānau at the time, not all of it that was helpful and useful, and a lot of it was negative and honestly quite scary for our whānau, the threat of this virus. And what we saw our comms people do was package that information to be more strengths-based, to talk about looking after yourselves, looking after your whānau, and being a much more positive message, which our people took on board. So that very clever, I can only say it's clever because these comms people were amazing. That clever way of repackaging that information so our people took it on board was just one of the most amazing things that we saw throughout the lockdown period. So what does this all mean and what have we learned? In the Te Rangatupua area, we learned some very practical lessons. How our relationships with our other entities within the rohe, civil defence, police, our councils, how we must strengthen those relationships to manage something like this pandemic. Those relationships were key. They always have been, but we know that we need to strengthen them further. The importance of data and what data we need to understand our whānau. We rely on our whakapapa links, on our knowledge, but we didn't necessarily have hard data on where all our people were. And then the need for pandemic plans. So we had this in our rohe great experience with the 2015 floods, but this was very much a different emergency, and it was a health emergency, and health needed to come to the fore, and that's what we saw with our leaders. And so the need for pandemic plans rather than simply emergency or disaster relief plans. And across all of that, how we work as Māori, we know that for our well-being to really thrive, we need to be in that driving seat. And I think that was the key message that came across for everyone as a consequence of the COVID-19 lockdown and subsequent months beyond. We saw iwi working in spaces and having freedom and flexibility to just get stuck in. And when they had that freedom, we were able to look after our people. And so that is enduring, that desire to be in that driving seat is enduring. We see it today still, and it's probably the most important lesson for all of us. We know this as Māori, but we need to keep that message clear as well. So kia ora koutou. Sorry, it was a bit of a whirlwind. Just want to thank everyone that contributed over the many years to the work and to our funders. And I'm looking forward to hearing what our other two experts have to say, specifically from their points of view about this. And I do have some references if people want them. I know this is a very tiny slide, but you're welcome to my slides after. So thank you.
Kia ora, ngamihi atu kia koe amohia mo tēnā kōrero, kia koutou, kia tātou katoa I tēnei ata. Nō reira, tēnei te mihi. Whānau, just a reminder that the accessibility code is cut and pasted into the chat. Also, if you have any questions, please put them up into the chat, and Gillian will make sure that myself am able to ask Amohia any questions you may have of her presentation. Anō te mihi kia koe, Amohia, mo tēnā kōrero. Nā, haere te toko kia koe e Colin. And we'll just now pass the talking stick over to our Colin. Nō reira, tēnā koe e te rangatira.
Tēnā koutou katoa. For a minute there, Lisa, I thought you were saying pass the walking stick to Colin. I am old, but I don't need a walking stick just yet. Tēnā koutou katoa. It's a pleasure to be here, and thank you to Heather and the team for inviting me. I don't have any slides. I'm just going to speak for a few minutes on COVID-19. My views on this are well known. I wrote a paper in a newsroom in 2022 titled A World-Class Response Undone by Inequities. In the interest of full disclosure, I should also say that I was a member of the technical advisory group to the Ministry of Health on COVID-19. Therein lies the issue of advisory groups and our respective roles in these things, but that's kōrero for another time. It is correct that our response is widely regarded overall as world class. Unfortunately, we did not protect members of our community that were most vulnerable. This is not new, is the other thing I should say, and I'm disappointed that we don't learn. 1918 has been referred to repeatedly and its impact on Māori. In the same event, the good ship Talune went to Samoa, poorly managed by our government at that time, and resulted in a tragic loss of life. Some quarter of the population there succumbed. So there's no doubt, I think, that our response to COVID-19 overall for most people was world class, but we didn't do what we should have done, and we didn't learn from our experiences earlier. By the way, we've had similar outbreaks of viral pandemics over the years, and it's the same story. Māori and Pacifica people most severely impacted. And again, this is well known. The Waitangi Tribunal hearing provides a good summary of the issues we faced. Haumaru, if you haven't looked at it, it's a good record of. So I think it's a fair assessment that we did reasonably well overall, but we didn't do what we should have done, protect our members of our community that are most vulnerable. That's the measure of an advanced and informed progressive society. How well do you look after your most vulnerable members? I also want to acknowledge Lisa and the karakia. One of the lines she said was, stick to what is right and what is true. And I think what is right is and what is true. But what is right is really what this is about, I think. We didn't do what was right. We didn't do the right thing overall. And a couple of examples. I'm referring here to the Pacific community. You know, that simple expression, isolate at home. If you have COVID-19, isolate at home, don't go to work, and so on. That sounds logical and sensible for what it is. But you know, there was a failure to understand what that meant. 40% of households, whānau households in the Pacific community are crowded, overcrowded. And it's simply not possible to isolate safely. And so your whānau is at risk. And we tried and tried and tried to inform our colleagues that this was not a practical thing, and that there should have been alternatives, options for whānau to isolate safely when their home circumstances were not great, shall we say, because in a way we were putting other members of the whānau at greater risk. The second example I want to raise, it relates to the COVID vaccine rollout. They did this big song and dance about a big mass vaccination thing out at this convention center in Manukau. And we said, we don't think this was the right way to go, but they went ahead and had this big mass drive, and lo and behold, most of the people that got vaccinated at that event were Pākehā and Asian members of our community, and it's great for them. But, you know, barely 1,000 Māori and barely 1,000 Pacifica people got vaccinated. Again, we knew this was going to happen. We were going to vaccinate those who needed it the least and missed out on those who needed it the most. It's not rocket science. And we had these conversations about conventional delivery is inadequate. Conventional delivery of services will aggravate inequities. And you can draw your own conclusions from that. Why is that? Is it racism? Is it subconscious bias? Is it whatever? But we knew ahead that this was going to happen. And I shouldn't be so dwelled on the problems, because the solution was delivered by our own communities. And many of you will have seen the drive-ins through the churches. In other words, in late October, November 21 or 22, I can't remember, the Pacific community, through our collective efforts of information sharing, of encouragement, of kōrero, of all of that, stepped up. The communities and the Pacific providers delivered vaccination to our own communities through the drive-ins, through the churches, through mobile clinics, through a whole lot of things led by and driven from the Pacific community. So the Tongans, I still think the Tongans set the trend with a big drive-in at the church there in Whabona. And of course, Pacific people not wanting to miss out on this, the Niueans organized their own, the Samoans the same, the Cookies the same. And in the end, I have to say, we probably got one of the best uptake rates for Aotearoa, for dose 1 and dose 2. And I attribute that totally and without hesitation to community leadership, to community action, to Pacific providers stepping up and working with the communities. You know, sadly, we should have done this from day one. Why did we have to go through all of that in order to get to the point where we got? So in the end, I think we got a good result, but it was a slow start, something that should have been totally predictable. And my own view is if this should happen again, there should be a Māori-led and driven strategy alongside whatever conventional delivery we're going to offer our whole country. In other words, I think it wasn't exactly anything particularly new, and we should have learned the lessons of history. Kia ora, whānau.
Tēnā koe, Colin. Yes, I never said walking stick. So, ngā mihi atu kia koe te rangitira
I don't need it yet, Lisa. I might need it at some point, but not.
Ngā, anai te mihi ki a koe me tō harikoa mo tēnā wā. Nā te mea te mihi ki a koe mo tō kōrero i tēnei ata. Nō reira whānau, ka haere tonu i te kōrero, mā kuho atu te toko kōrero ki a koe Kevin. Nō reira, tēnā koe Kevin.
Tēnā koe, Lisa. Morena koutou. No ingarangi o ku tupuna, engari ko kirikiri roa te whenua tupu, ko mawhera te kāinga, ko Kevin Haig tōku ingoa. It's great to actually not see you, because I can't see you all, but it's fantastic to have good attendance at this session. And look, as others have said, thanks so much to the organisers of this conference. It's a really great initiative, and sort of building treaty-based futures is what we should all be about. Look, this first slide, as you can tell, the picture was taken a while ago, but the hairstyle is still the same. These are my current roles, and as Lisa has said, today I'm speaking as me. I'm not speaking for any of these organisations that I'm part of. And what I'm looking to do today, it's a little bit of a gear change from the two presentations you've heard already. I'm talking about civil defence emergencies, and I'm looking to just make some observations and hopefully set a baseline that might start conversations rather than putting an argument to you. So this is mawhera, greymouth. I prefer mawhera, and it's great to see that in our town now, mawhera, the word, is more prominent on all of the signage than greymouth is. I guess the thing that I'd say about this is you can see I don't know if you can see my cursor moving around, but I live around here. You can see that this is a town that's built at the mouth of a river. And you can understand why so many of our towns are on rivers and so many of them are at river mouths. But we are a place that has a lot of braided rivers and a lot of flooding events. Drowning in rivers was referred to in the 19th century as the New Zealand death, because it happens so frequently. And that causes a whole lot of risks. So in civil defence, you know, here are some examples of the risks that we prepare to manage and end up managing. But it's probably, for me, on Te Taipaitini, the flooding and extreme weather events are the ones we deal with most frequently. But the thing about those is you generally know they're coming. So you know that a weather system's coming that's going to deliver a lot of rain into the mountains. The one we are most concerned about and frequently plan for is earthquake, specifically a rupture of the Alpine Fault, which would cause a lot of devastation, and as you probably know, we're overdue for it. So that's a sudden onset. But all of those things, and you notice that pandemic is in there, are potentially things that we might need to deal with. Here's Franz Josef Waiau. So there is a braided river. Up in here there's the glacier, of course, that you can't see any longer. It used to come right down to the sea, in fact, at one point. The town is at severe risk of flooding from this river. The defences on the river, flood banks, they were in the news again this morning, you know, are particularly bad here because at one point they were built by, I think it was the mayor of Westland and a mate of his who also used to be the mayor of Westland, who owned a bulldozer. And they sort of went on down and said, well, rather than worry about all this red tape, we'll just do it ourselves. Do it yourself, mate. And so the flood bank that they built is at severe risk of collapse or through being undercut by the river. The other thing that is not immediately apparent on this particular view, this is an aerial view of the town, is that the Alpine Fault runs pretty much directly through it. There's also a big fault off the west coast of the South Island, which would put this place and basically every other town or settlement up and down Taipotini at severe risk of impact from tsunami. So we have the trifecta here. This is the Wharenui Kaipo at Te Tauraka Waka a Maui, one of two marae on Te Taipotini. This is the marae of Ngāti Mahaki at Mahitahi, or Bruce Bay as it's sometimes referred to. What you can't see is that just over this fence basically is the road, that's State Highway 6, and immediately on the other side of the road is the beach. So if we have that tsunami or a severe weather event or an erosion event, this marae is at really severe risk. And I guess that's one of the points of my presentation this morning, is that Māori and Māori communities seem to be at particularly high risk of impact from civil defence emergencies. And if you think just now from your own knowledge of all of the marae, all of the urupa, that are right down at sea level, or near river mouths, the impact from these natural disasters could be very severe indeed. This is the 4 R's, it's called in civil defence. Civil defence has an Act of Parliament which basically sets multiple levels. It says you can have emergencies at a national level, and response to those is coordinated by NEMA. You've probably seen them in their styly jackets, the National Emergency Management Agency. But if the emergency is at a regional or a local level, the governance of the response is led by regional government and local government. And I guess this is one of my key points, is that the quality of these 4 blocks varies according to which the regional and local council is. And specifically the aspect of quality of inclusion, responsiveness, treaty basis for any of these blocks will depend on which of the councils they are. So I imagine up where you live, Lisa, in the far north, I imagine it's pretty damn good. But there are councils where mayors don't believe in beginning hui with karakia, for example. And if I were looking to a council that's likely to have a weak response, that's probably where I would start. Oh, there's a slide of Wade Brown. I'm not sure how that got in there. Here's Kitty Allen. So 2021, making this point about the disproportionate impact of natural disasters and emergencies, but also the extraordinary capability for iwi hapu whānau in responding to these disasters. I'll just go back a couple. There are these blocks, and this one, the response, so this is the thing that happens in the heat of the emergency. That's where the focus is. But actually, most time is in these bits, risk reduction and readiness, and in what happens after the immediate disaster and recovery. So what we need to be doing is spending more of our time in planning on those things. In terms of risk reduction, here's Wairoa Valley, and from the cyclone. If we were to look at how Mātauranga might have helped in risk reduction, we might have looked at this word, Wairau, and thought maybe this isn't such a great place to be building all this human infrastructure. There's an island in the Marlborough Sounds, Rapauda Island, uninhabited because of tsunami. So that is kind of knowledge passed down to kuiho, around why that place is uninhabited. And we probably thought, sort of Pākehā knowledge about risks, we thought that that was not a place that was subject to tsunami. So there is an extraordinary database, if you like, knowledge base from Mātauranga Māori about risks and how to reduce them. Here's something about risk reduction and sort of readiness for emergencies. Massive improvement in readiness to be able to deal with emergencies when Te Reo Māori was used in the materials that got sent out. Well, who knew? So, again, there's that sort of Māori dimension that's present in some places, and I would say overall in civil defence it's improving quite a lot and quite quickly, but it's still very, very patchy. Some of that risk reduction is around where are the right places to do things, and here's another example that you'll all know. I don't need to say any more about, I think. I mentioned before, so this is the structure that is used in responding to an emergency. So first of all, here's the governance level. I mentioned, depending on whether it's a national, regional, or local emergency, governance might be the government, central government, or it might be regional government, it might be local government. Don't worry about these two blocks. This is the job that I do as controller, and this is a model that has basically come from military and emergency services from around the world. It has changed quite a lot. One of the changes is that recovery is in right in the response. So we are starting to think about how we will recover from this thing as soon as an emergency hits, and we're even in the heat of responding to it. And here is the other big change in the current version of this plan. This is the idea of the structure, is that wherever an emergency is being responded to, and in whichever level, the same structure and the same roles exist, so that you have interoperability. So someone who does a planning role, for the Selwyn District Council, could go to the Hawke's Bay to help out with the planning role in the response to Cyclone Gabrielle, and in fact, many of us did. The thing that I would say about this, so mostly, while the structure allows for these roles in red, for the most part, they, with the exception of these science and technical advisors who we generally have available to us, there's generally people not in these roles, because we don't have the people on the ground to do them. And if you think about capacity of iwi and hapu, it's the same people being drawn in many, many different directions. And so their ability to be part of this structure in preparing for a disaster is severely reduced. So while they might come into the kind of control room to be an integral part of the way an event is responded to, they probably haven't been part of the lead up to that. And these roles are all entirely standard, so you'll see them in every response. Here's, I'd say, a first go at converting some of that thinking into a form that probably fits better for iwi and hapu. This is very early stages and is not yet the structure that we use, but it's kind of only a small variation. I guess the thing I'd say about, so just going back to that, if you think about who is in these roles, so controllers are mostly people like me, volunteers, or they're council officers. You know, they might be chief executives or the second tier down, and many of these people are also council employees. And so those issues of variability of the response depending on who the council is, you know, are reflected directly in who's actually doing this work in an incident. And while this is, you know, certainly if I'm the controller, this is more a facilitated conversation between all of these people. This model actually started as very much a command and control model. You know, the role of the controller is to make decisions. So make a plan, present it to the controller signs off on that, operations then implements the plan and reports back to the controller. You know, it's like a military operation. So here's Tangoi or Marae in the Wharenui during Cyclone Gabrielle, 2.5 meters of silt. On that list of civil defence hazards that I put up before, climate change isn't there. But actually that's because nationally we respond to climate change on a different time scale. But we're going to see more and more of these impacts. So the need to respond immediately in marae, in Wirrapa, Māori communities around the Motu. And this is the recovery, as I said, and this is my last slide. We now have the recovery function. So whatever has happened, this community needs to respond. And you know, I was really happy. I didn't say it right at the beginning, but most of my background has been in the health sector and specifically in the field of health promotion, which says you kind of deal with health issues by empowering communities and creating supportive environments around them. That's actually the model that civil defence uses for recovery. So what in civil defence, we kind of say communities themselves will they will know how to get this right. Our job is to give them tools and resources and clear the way for them to be able to do that. So this is probably the aspect of civil defence that has that's most in tune with the sort of tiriti-based futures kaupapa of this conference and this session. But the whole of the civil defence ecosystem is moving in the right direction. So those are my remarks. Sorry, that took probably a bit longer than I hoped to, but it was less than the 3 hours that I sometimes talk for. So, kia ora, Lisa.
Kia ora, ngā mihi Kevin, tēnā koe. Great to see, well not great, but to see those slides and the devastation that's been caused and the responses there. Whānau, look, again, the mihi, kia mihi, e mihi ana kia koe, Kevin, koutou amohia me koe te rangatira Colin. Whānau, we've got some questions, but before I go to the questions, I just want to recap on a couple of 4 things that have been shared this morning. Amohia talked about the Māori, iwi Māori leadership and the mobilisation through them to whānau in her rohe of Te Rangi Tupua. About how whanaungatanga, which is also what Colin mentioned in his kōrero around, it was the whanaungatanga that mobilised our whānau Māori, whānau Pacific Island, to get vaccinated through this time. That there was in both of Colin and Amohia's conversations, presentations about the collective approach, the strength-based approach of repackaging information that was not geared specifically at us, but repackaged for us, by us. One of the key things that I heard Colin talk about was that we still don't learn. We haven't learned over all of these things that have happened to us here, despite New Zealand having a world-class response. We did not focus or learn from previous experiences on those of us most vulnerable in our community. It was interesting hearing Colin talk about the 40% of Pacific Island whānau who isolation was not something safe or wellness focused for whānau of the Pacific Island. Pacific Island whānau in and around South Auckland and further afield from there, which would be similar to Amohia's kōrero in terms of being remote rural. Our whānau are already isolated, but this pandemic even isolated them more perhaps. And then of course back to Kevin's kōrero around again, Māori communities know how to respond. Those 4 boxes, we know how to respond, as does Pacific whānau communities know how to respond. Our tangihanga is an absolute example of responding to the unknown in terms of logistics. So how, and you know, seeing Kevin's jigging of the CDEM governance model and how that can be better suited in all areas that our 3 rangatira this morning have touched on. So that's my brief synopsis on the sharing given by you 3 this morning. To our participants, so mihi atu anō kia koutou. I want to thank you all for your time and energy this morning in sharing. I want to thank our volunteers and our partners in the background who have helped bring this event to life, and of course all of our other webinars that have been happening over this time. Our 35 organisations, wow, 35 of them that have been supportive of this kaupapa around racial justice and emergency responses. I want to also to share that the Kei Te Muru o Te Ahi The Marathon for Racial Justice is on Friday the 22nd. That must be this week sometime on Friday. So that's running all day. You can drop in, and there's the slide for that. I want to also make mention too that the Waitangi Tribunal report that Colin mentioned in his presentation is there on the chat, as is a number of other links that Amohia has provided in terms of the data. So they're in the chat there if you haven't already got that. I know it will be available going forward. I'd also just like to, there's 3 questions. The first one, Kevin, to you. In that iwi, the structure slide, in terms of the governance and the policy and the strategic green boxes at the top end, are Māori iwi, are we part of those 3 boxes? That's a question coming through from Lorraine Toki from up here in Ngāpuhi. You're on mute, Kevin.
It's good practice to be on mute when I'm not talking. Only indirectly, because really at the governance level under the Act, it's our national government, or regional government, or local government. So they have that governance responsibility. So there isn't a direct, iwi box there. However, of course, increasingly, and let's hope it continues to be increasingly, iwi are present at those 3 tables and exerting more and more influence. It would be great to see a new model that sees iwi more directly involved at that governance level.
Okay. Cool. Kapai. There we go, Lorraine. Not the best answer, and somebody on the side there has said that we need to change the Act to get iwi directly involved there. The next question is to Colin and to Amohia. Firstly, Amohia, the data, and one of our participants, Suzanne Bartholomew, wants to know, in terms of the data, was there a formal database in place, and how are you keeping track of whānau up there in your rohe so that comms is maintained should and when another pandemic or emergency disaster occur?
For our particular rohe, the issue of data was a key one that came out. It was really, really, really fraught and remains somewhat unsolved today. And a lot of it, I guess, depends, there's so much that's in here. So a lot of it depends on the ability of having really good data technicians. One of the things that we saw during this time was that within the National Iwi Chairs Forum, there's a iwi data leadership group, and that group, and Te Mana Raraunga created Te Whata, a data platform driven by iwi for iwi as a consequence of COVID. So we have something at national level, but individually at the iwi level, we need that capacity, multiplied and spread out, of course. So one of the key learnings for us in the Te Rangatupua rohe is, what data do we need? How do we build our databases? Can we collectivise our databases without impacting our rangatiratanga and our individual information that we hold as iwi? So just huge issues that remain ongoing. But we have informal ways of knowing who our people are, and that's the beauty of whakapapa and whanaungatanga. So in the absence.
Kia ora. Kia ora. And back to you, Colin, just in closing our questions. How are the whānau, Pacific Island whānau, collecting data? How is that happening from where you sit for and on behalf of whānau Pacifica? Mute? Sorry, you're on mute too, Colin. Sorry.
Interesting a comment from Amo here and your question. One of the recurring problems we had in terms of the Pacific response was the inability and the reluctance of our friends who control the data to share it with us. If you recall, the drive-ins through the churches relied on Samoans knowing more about Samoan communities, Cook Island, etc. But our standard response from the data people, and they did their best, I guess, we just have some clumsy rules to share the information with us, but Tuvaluan community, in order to have effective interactions with them, we needed more detailed information, which we didn't get. So clearly data is a critical issue that we constantly had to face. As I say, our friends in the data space did their best, but it was not good enough. So this is clearly something we need to try to sort. Look, I want to finish by saying I hope when we're threatened again by something like COVID-19, the first thing to do would be to enable, empower, resource, inform, support Māori to lead a response. Ditto Pacific communities. In other words, let us not rely on conventional planning and thinking and delivery. I hope we all have learnt from COVID-19, famous last words, Lisa. Kia ora.
Tēnā koe, Colin. Ngā mihi atu kia koutou anō. Look, what a great way to finish in terms of this this webinar, to be reminded about the racism that still occurs and the unconscious biasm that occurs in the system, and how that, wherever we sit, whatever role we have, who are we wero? Ko wai, are we challenging our own system where we sit in our place? Are we brave enough? Are we having those courageous conversations to make a difference for our whānau, for whenever, whatever the impact, not the impact, whatever's happening, and how are we standing up more often to challenge the norm that is being done to us? So tēnei te mihi atu kia koutou, kia tātou, kia koutou katoa, ngā whānau, kei te haere mai te whakarongo e nei rangatira. Ngā mihi atu kia koutou, nā te mea kānui tēnā webinar. And we still haven't found the kupu Māori for webinar there, Amo here. Lorraine, koutou mai e whakarongo ki tēnā tūranga, nā te mea māku e kapi tēnei hui huinga ki raro i te atu i te rongarawa, nō reira inoi tātou. Kia tātou katoa, te ata whai o tō tātou arakia I hu karaiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, ake, āmene. Mauri ora koutou, tātou katoa, kia pai a koutou rā, a koutou wiki hoki. Nō reira, tēnā tātou.
Mauri ora.